So today I'm going to be performing an assessment on skin, hair, nails, head, eyes, ears, nose, throat, and musculoskeletal, and then providing education to my patient on how to perform a self-testicular and breast examination. I'm going to start with my pre-procedural steps, which would be to check my nursing care plan, gather any needed supplies, wash my hands, enter the patient's room. I'd introduce myself and get two patient identifiers, their name and their date of birth, and then I'll explain the procedure to the patient and raise the bed to the appropriate height. So I'll start my assessment with the skin. First thing I'm going to do is inspect the skin to make sure that the color is appropriate for the patient's race and ethnicity. I'm also inspecting to make sure there are no lesions, ulcers, or lacerations on the skin. Then I'll move on to palpating the skin, which I'll do with the back of my hand. And I will note that the temperature is warm, the texture is smooth, it is not excessively dry or there's no excessive perspiration. And then I will check for the turgor, the skin turgor, by pinching the skin and releasing it, making sure that it returns to baseline levels within 2 seconds, indicating that there is no tinting. And then finally, I will press on the skin to make sure there is no edema. And that will complete my assessment for the skin. So I'll move on to nails now. The first thing, I'll inspect the patient's nails to make sure that the nails themselves are clear and concave and the nail beds are pink. And then I also note that the nails are of moderate thickness and do not appear to be cracking or breaking. Then I will palpate the nails and press down on them to measure the capillary refill and make sure it is within 3 seconds to indicate there is no cyanosis going on. And I will also have my patient, sir, if you could please place your fingernails together like such. I will inspect this to make sure there's a diamond shape between the nails to indicate there is no clubbing that is going on. And that will complete my assessment of nails. So now I'll move on to the head. First thing I'm going to do is inspect the head to make sure it's normal cephalic in size and round in shape, which it is. And so then I'll move on to palpating of the head. When I'm palpating the head, I'm just making sure that there are no lesions, nodules, masses, protrusions that are irregular, and there are not. And while I'm doing this, I'm also palpating the hair and making sure that it is evenly distributed. There are no bald spots. The hair is not falling out. It is not extremely brittle. It is, and making sure it's properly lubricated, not too dry or too oily. Then I will move on to inspecting the scalp. I will displace some of the patient's hair in order to make sure the scalp is intact. There are no scabs, vermin, or lesions on the scalp itself. And that will complete my assessment of head and hair. So then I'll move on to the face. The first thing I'm going to do when I evaluate the face is I'm going to inspect to make sure that the facial features, the eyelids, eye sockets, eyebrows are all aligned, symmetrical, and proportionate to the face. I will then palpate the frontal and maxillary sinuses to make sure there is no edema or tenderness. I will then move on to palpating the lacrimal apparatus, which is above the eyes. Again, just to make sure there's no tenderness or drainage or edema that is building up there. And then now I will move on to my assessment of the patient's eyes themselves. The first thing I will do in my assessment is note that the sclera is white, and then ask my patient to please pull down their eyelid to note that the conjunctiva is pink. So now I'll move on to assessing the patient's pupils. So the way I'm going to do this is I'm going to place my hand in the middle of the eyes. Using my pen light, I want to make sure that the pupils are equal in size, round, reactive to light, and accommodate equally. So I will perform this test on both eyes. And I note that the eyes do accommodate to light or respond to light, and they do accommodate equally in both eyes. So after I've done this, I'll move on to testing the patient's visual acuity. So, sir, if you could please just keep your head in place and then follow my pen with your eyes only. So I will go in the 6 cardinal directions in order to test for visual acuity. And I will note that the patient's visual acuity is intact and that their red reflex is also intact. And this will complete my evaluation or assessment of the eyes. So now I will move on to the ears. First thing I'm going to do is to inspect the ears to make sure that they are aligned on the head and that they are symmetrical. Then I will move on to the actual inspection of the ear themselves. For an adult patient, I will make sure that I pull the pinna upwards, and this is where I would insert my otoscope. Today I don't have an otoscope, so I'll just be using my pen light. But if I did, I want to also palpate the auricles to make sure there's no tenderness, and inspect them to make sure there's no erythema. But when I'm looking inside the patient's ears, I want to note that the tympanic membrane is intact. It is pearly white or gray. And then on the right ear, there's a cone of light at 5 o'clock, and on the left ear, there's a cone of light at 7 o'clock. I also want to note that the bony structures inside the ear are intact and that the ear canal is not filled with any debris or excess earwax. Now I'm going to test the hearing acuity by using the whisper test. So, sir, what I'm going to do is I'm going to have you plug one of your ears, and then I'm going to whisper a phrase into the other ear and have you repeat the phrase back to me. 1, 2, 3. 1, 2, 3. Okay. ABC. So during this test, it's important to make sure that the patient cannot see your mouth. That way you know you're getting an accurate test of their hearing. And for this patient, I would note that the hearing is intact and they successfully completed the whisper test. And that will complete my assessment of the ears. So now I'll move on to the nose. The first thing I'm going to do is just to inspect the nose and make sure that it is proportionate to the face and that it is symmetrical. Then I'll have my patient tilt their head back, and with my pen light, I will inspect the nares to make sure they are symmetrical and that they are pink and moist on the inside, but that there's no excess drainage or mucus buildup inside the nose. And then I will move on to testing the patient's smell and patency. In this case, I do not have a cotton swab, but in normal scenarios, I would take some alcohol, put it on a cotton swab, have my patient plug one of their nostrils, lift the swab up to their nose, to their open nostril, and have them inhale and tell me what smell they recognize. And this would indicate that their smelling ability is intact, as well as their patency. So now I'm going to move on to inspecting the patient's mouth. So, sir, if you please open your mouth and say ah for me. And so while the patient is saying ah, I'm looking to make sure the lips, mucosa, gingiva, tongue, and palate are all pink and moist. And when he says ah, I want to make sure that the uvula is midline and that the palate raises upward towards the midline and is symmetrical in that form. And then I'm also checking to see that the dentation, there's no missing or broken teeth or no caries that are visible to me. And for this patient, I would note that there are none. So this would complete my assessment of the mouth, and now I'll move on to the neck. So the first thing I'm going to do is to palpate the thyroid, which should not be palpable in my patient, and it is not. Then I will move on to palpating the trachea. I want to note that it is easily displaced and supple and is not rigid. I will then move on to simply palpating the rest of the neck to make sure there are no masses, nodules, protrusions that are irregular. And then finally I will check the patient's lymph nodes. So I will start with the preauricular, then the postauricular, the occipital, the submental, the submandibular, the jugulogastric, the jugulogastric, the superficial cervical, the deep cervical chain, and then the supraclavicular. And I want to note that none of these lymph nodes are palpable. So now we're going to move on to the musculoskeletal assessment of the patient. The first thing I'm going to do is have the patient stand up and to inspect their posture. I'm going to note that the shoulders, the scapula, and the hips are aligned and symmetrical, and in my patient they are. And then what I'm going to do is I'm going to check the spine for scoliosis. So to do this, I'll place my hand on my patient's lower back, and I will instruct them to lean forward. And as they're doing this, I'm running my hand up their spine. Now please lean back. And then following it back down, just to make sure that there's no curve in the spine and that it is straight. And also while I'm doing this, I'm inspecting the shoulders, scapula, and hips to make sure that they are aligned and in sync with one another and symmetrical. So once I've inspected the patient for this, I will then move on to inspecting their gait. So, sir, if you would please take 4 steps that way, turn around, and take 4 steps back towards me. So while my patient is walking, I am inspecting their gait to make sure that it is smooth, rhythmic, and flowing, and that there does not appear to be any type of disruption in their gait. It doesn't appear to be forced or stressed. After I've assessed their gait, I'll then move on to assessing the range of motion for each of their joints. So, sir, if you'd please have a seat right here for me. I'm going to start, scoot up a little bit. I'm going to start the assessment at the head. What I'm going to do is instruct my patient to flex, extend, and circumduct the head. And I'm checking to make sure that my patient has the full range of motion, that there is no issues there. And then I'm going to move on to checking the strength. So I'm going to place my hand on the side of the patient's head and instruct them, don't let me push your head to the left. Okay? Now, don't let me push your head to the right. Okay. So I note that the patient's head has the proper strength and it is equal on bilateral sides. So then I will move on to assessing the range of motion of the shoulders. I'll instruct the patient to raise, depress, and circumduct the shoulders. Okay, and so I'm just again assessing that there's symmetry in the shoulders and that the patient has the full range of motion that is expected. And then to test strength, please raise your shoulders and don't let me push down. Okay, so now I've assessed the strength of the patient and note that it is the strength is equal bilaterally and the shoulders are symmetrical in their range of motion. So after I've done the shoulders, I can now move on to the arms. What I'm going to do is instruct my patient to abduct, flex, and extend their arms. So, sir, please abduct, flex, and then extend the arms. And I'm noting that both arms have full range of motion and they're symmetrical. And then I'm going to test the strength bilaterally. So, sir, please raise your arms up. Don't let me push down. Okay? Don't let me pull up. Okay. So I note that the strength in the arms is equal bilaterally, and now I can move on to the wrists. So for the wrist, I'm going to instruct my patient to extend, flex, and circumduct. Okay, and so I note that there's appropriate range of motion in the wrist, and then to check the strength, I will have the patient grip my fingers with each hand at the same time. So grip, okay? Noting that there is appropriate strength in the wrist and that it is equal bilaterally. So now I will move on to the hips. Sir, if you please stand up. You can use this chair to brace yourself. I'm going to now assess the range of motion of the hips by instructing the patient to abduct, and circumvent the hip. Okay, now with the other leg, sir, same thing. Abduct, adduct, circumvent. Okay, now note that the range of motion is equal bilaterally And then I'll move on to testing the strength of each leg. So I'll have my patient extend the leg out and don't let me push down. Don't let me push up. Okay? Now for the other leg, don't let me push up. Don't let me push down. Okay. And so now I note that the strength in the hips is equal bilaterally and appropriate for the patient. So now I can move on to assessing the patient's legs. Sorry, you can have a seat. So for the assessment of the range of motion of the legs, I will instruct my patient to extend, flex, and circumduct the leg, both legs. Now, sir, please repeat with the other leg. Extend, flex, circumduct. Okay? And I note that the patient has full range of motion that is appropriate. And so now I'll test the strength of the legs. So, sir, please extend your leg. Don't let me push up. Don't let me push down. Okay? The other leg. Extend. Don't let me push up. Don't let me push down. Okay. So now I note that the strength is equal bilaterally in the legs and appropriate, and I can move on to the ankles. So I will instruct my patient to extend, flex, and circumduct their ankle. Now please repeat with the other leg. Extend, flex, circumduct. Okay? And I note that the patient has full range of motion in their ankles, and I can move on to testing the strength. So I will ask the patient, do not let me push up on your foot. Okay? Now don't let me push down. I'll repeat with the other leg. Don't let me push up. Don't let me push down. Okay. So I note that the strength in the patient's ankles is equal bilaterally and appropriate. There's no weakness. And then now that will conclude my musculoskeletal examination, and I can move on to the education on the breast and testicular. So now I'm going to educate my patient on how to perform a self-breast and testicular examination. For the breast examination, I want to inform my patient that they should perform this examination the same time each month. For females, it should be at least 7 days after their menstrual cycle. And what they should be doing is looking for, well, I would educate that it is normal to see some asymmetry in the breasts, but when they're examining their breasts, inspecting them, they should be looking for any dimpling or retraction of breast tissue. So the way they would do this is their hands on their hips, lean forward, and to inspect the breast for that dimpling or retraction. And another way they can do this is also to place a pillow on a bed or a flat surface behind their scapula, and they can inspect the breast tissue in this manner as well. For the palpation of the breast tissue, I would instruct them to use a vertical stripe pattern and encourage them that they should especially focus on the tail of Spence area, which is right here close to the armpit, as this is the most common area for masses and tumors to grow in the breast tissue. So it is very important for them to make sure that they palpate their entire breast. So then I will move on to, another part of the breast examination. They also want to squeeze their nipple and areola area, firm, but not too hard, just to note that there's no tenderness, and also that there is no drainage. So moving on to the testicular examination. This should be performed every month, and it's best performed after the individual, the patient, has taken a shower, because this relaxes the testicles and the scrotum. And I would educate my patient that it is normal for one of the testicles to descend lower than the other one, and that it is wrinkling of the scrotum is also normal. And I would educate them that when they're palpating their testicles, similar to the breast examination, they want to use a vertical stripe motion. And I would inform them that it is normal. There are some landmark masses inside the scrotum, such as the epididymis at the top and the spermal cord, and that these should be spongy and soft feeling. They should not be hard, and there should not be any nodules or masses in the testicles. And these are the things they should be looking for. So that will conclude my education on self-breast and testicular examination. So now I'll go through my post-procedural steps once my assessment has been complete. First, I will lower the bed back down to the lowest locking height and raise the guardrails. I'll make sure my patient has their call light within reach, and then reassess them to make sure there are no further needs they have or any other questions for me. I will inform the patient when I will expect to return, and then as I'm leaving the room, I dispose of any PPE that I may have been wearing. Next, I will wash any equipment that was used during the assessment or procedure, and then wash my hands and document what took place in the room.